is Nick Binney, and I'm a therapist here at the Entry Center. What you're about to see is a part of a series of videos that I'm doing where I interview different staff here in order to learn and show what it is that we do at the Entry Center. We have a lot of wonderful, dedicated people working here, and I'm excited for you to be introduced to some of them. These videos can be used by clients, by staff, by community members, really anyone that is interested in learning more about the different ways that we try to serve our community. I hope you enjoy this video, and please see the other videos in this series to learn more. Thank you.
I am Charity Williamson. I am an adult mental health case manager / mentor, and I work here at the Entry Center.
Okay. So mentor, is that mentoring for the other employees?
Yes, other case managers overseeing them, make sure once they're trained, if they have any questions, need any help, guidance, I'm there to assist and help them.
Okay, awesome. So adult case manager. Excellent. What, if you feel comfortable, does your kind of education background look like?
No, it's a Bachelor of Science in Psychology.
Excellent. And that's kind of the level that these students might be entering at. So the Bachelor of Science or Bachelor of Arts. So they could come in to a position like the one that you have.
Yes, they could.
Okay. Well, I have to imagine, thinking back to that time, I didn't know what the heck a case manager was or what that meant. So how would you define that? What does that mean to be a case manager?
The closest I could say is if you think of a social worker, that yes, you know, this is a mental health outpatient facility, but you don't just meet their mental health needs. Yes, that's our primary focus, but it can be anything from transportation issues, housing issues, food, clothing. I mean, just day-to-day stuff that does affect their mental health and overall well-being, you know, along, of course, with the primary goal of us ensuring that their mental health needs are being met.
Absolutely. So a lot more encompassing than just sitting down and talking about mental health related stuff. It sounds like helping them get access to resources, we might say.
Yeah, and it could be in the office or you go into the community and help them. It's not just office work, you know, sometimes you go to their homes, sometimes you accompany them to their appointments in the community.
Okay.
Or, you know, you meet them different places. You try to meet them at whatever level they're at and they feel comfortable.
Okay. I think I've heard of folks, case managers meeting with clients like while they're trying to do shopping, if like shopping and being in public is like a really big issue for them. Have you ever done anything like that?
Yes, definitely. I've gone to a grocery store and, you know, helped them pick out stuff within their budget, what's smart, what's not smart to buy, or, you know, various places if they need to go to the doctor, sit with them, or food banks, you know, places where they just don't feel necessarily comfortable or they just need that little bit extra guidance.
Okay. How wonderful it must be that you're able to provide that for your clients.
Well, we would like to think that that's a good thing, definitely. I mean, it
Yeah,
does make us happy when it's a successful situation.
absolutely. So I guess I wonder what do you think you might do in an average day of your job? Like what all are you doing in a normal day?
Well, that's one of the positive things about this field, and negative things. It changes constantly. You're
Okay.
constantly meeting with people to, you know, in here, update their assessments, recovery plans, try to work on coping skills, or like I said, the more practical things. But it just varies day to day, and your schedule might be one way when you come in the morning, but maybe a crisis happens, or maybe just something alters your schedule completely, so it varies, but most of the time it's trying to meet with people to see whatever their needs are in that particular spot.
For sure. So I guess what I take away from that is like you have to be able to be flexible.
I'm very flexible.
If you can't, you might not do so well in that position.
No, it can be frustrating to somebody coming in and they like a very structured schedule. It takes them getting used to that. If you like writing your schedule down on a calendar, it's not going to look pretty sometimes.
Be prepared to be marking out, revising, and all of that.
Yes.
Okay. So I guess a few other things that I was curious about in what you just described, there was some mention of like assessments and recovery planning. If you could give me an idea of what that means.
The assessments are basically when they come in, they're given a certain diagnosis, or the medication provider gives them a diagnosis. So you follow up with the assessments, and it goes anywhere from risk, like suicide, criminal background, to like the mental health part. Are you having manic episodes? How is your depression, your anxiety? Is there substance abuse in there? Their relationships with other people. And not only that, but then we go into their strengths, because a lot of them don't know how to focus on their strengths. So, do you have a support system? Do you have hobbies? Are you connected to the community in any way? How optimistic are you? Do you have a positive outlook on life?
Sure.
And then we take all that information and we go to the recovery plan with them, and we start to create with them their goals. What goals you have, and if they don't have any goals, then we start exploring that, and how can we get to have the results at the end. So it goes to a lot of different things. Who's going to support you in this effort? Do you have family, friends? Is it going to
Sure.
be the Andrew Center? So, we look at their barriers, their strengths, and we, put it all in there and try to create some plans so that we can start working on it with them.
Yeah, so it sounds like whatever they say they want to work on in that recovery plan, that kind of gives you as the case manager a direction, like this is what we together are working towards.
Yes.
Okay.
But it's always client driven, client focused, and if they change their mind and that's not what they want to work on, or if it's something that you're like, that's just not an attainable goal, you can't think that way. That's what they want. You go with what they want, even if it's some goal that says I want to be a football player, and they happen to be 35 years old, and there's no way they're going to play in the NFL. So it's always person-centered, client-focused.
Client, and like you said, client driven. So for you, it's very important to just be that supportive person in the process of like, I'm going to help you achieve this goal, whatever that looks like, or do the best I can.
Yep. We'll take those baby steps to get there if we have to.
Absolutely. And you mentioned like some diagnosis stuff. Now, do you do any of that in your position?
No, not at this level. It has to be somebody who's licensed that does it. And even the front line folks, when they first come in, they still hand it over to the medication providers, which are the doctors and nurses and physicians assistants, and they'll decide, finalize, and say that was the appropriate diagnosis, or no, maybe it'll be slightly different.
Okay. Now, sorry, I just blanked. There are a lot of different diagnoses out there. Let's call it what it is. Does the Andrew Center, and do you focus on any in particular, or you just say like, we're to work with all of them?
We are working with most of them now, but the primary ones we focus on are the schizophrenia, the schizoaffective disorder, or I don't know, is it called the schizoaffective? You probably will say it better than me. The bipolar and depression, but even some are coming in that have anxiety, substance abuse. There's even PTSD that's in there
Sure.
now.
Okay. So my understanding is you have to have at least one of those big three, the schizophrenias, the bipolars, or the depressions, and then you might also have anxiety, like you mentioned, or trauma, PTSD, or substance use potentially as well.
Yes.
So you would say you get a pretty broad, I imagine you get a pretty broad exposure to all of those different issues.
Yes, definitely. Every person is different. Even if they have the same diagnosis, there's always something different about each person.
Well, Charity, I appreciate you filling us in so far. I guess I just have a few more questions and then I'll let you get back to because I know how busy you are.
Sure.
As you think about being a case manager, what would you say the best part of the job is that you found?
Well, I like the job entirely. But helping people, that's always been my primary goal and focus on any job I've had. So that is the most rewarding part of it. And, sometimes it's helping people in the small ways or just giving them somebody to listen to. So that's always been my focus, and that's the favorite part of my job.
Absolutely. So just being able to sit with yourself and say, my time is well spent. I helped someone get a set of clothes when maybe they didn't have any, or I was able to go with this person to the food bank to make sure they had food today.
Yep.
Yeah. So I guess kind of the flip side of that, potentially, what is something that you feel like they don't tell you when you're thinking about becoming a case manager?
I think the worst part of it is when people come in, particularly to the Andrews Center, and it's not like that everywhere, but the fact that they come in because, they think that by being here at the Andrews Center, they're going to be able to obtain a disability check. And so they don't really care to work on anything. They're not going to have goals. They didn't really want to see you in the first place, try to avoid you at all costs.
Sure.
Because they know that is one of the extra things that we help people with, is to try to get, disability and SSI if they qualify, because that is an important part for some people's recovery.
Yeah.
But unfortunately, some people just focus on that, and that's kind of discouraging, that the individual who doesn't, they don't care, and they let you know that they just don't care to be here with you.
Yeah. So having folks that are just not motivated, that say, I don't really have much I want to work on. I'm just here for this kind of extra benefit potential. So absolutely. I imagine that would be very difficult as well, working with folks that don't want to sit there with you, for sure.
Yeah, definitely. Yeah.
Well, I reckon I have one more question.
Okay.
Like I said, some of the folks that might be watching this video may be considering a position in case management. So what is one tip that you might give to that person who is thinking about this as a career?
It feels more like, if you're at this particular level, it feels more like a calling. You have to want to do it. If you are getting into it for the money, then that's just not going to happen.
Not in mental
unless
health.
you work your way up, then yes, then it could happen. So to be patient, like I said earlier, the flexibility in your schedule, and realize that, You might have very trying days where you're not helping people, but if you help at least one individual that week, it is all worth it.
Okay, so we got a 3 for there. It sounds like you're saying, being patient, being flexible if your schedule's going to change, which sounds like it
Mhm.
is. And then being honest with yourself, like, do I really want to do this job? Is this something I feel called or led to?
Mhm.
Or am I getting into it for maybe the wrong reasons? And if so, you're probably not going to have a great time.
No.
And then finally, just to not get bogged down in the perceived negatives that feels like I haven't helped anybody so far, but really focusing on, well, I did help one person and that is my job.
Yep. Exactly.
All right. Well, Charity, I think that is all I have for you today. Again, I just really appreciate your time today. And I'm sure the students that are watching this appreciate your honesty and the kind of look into the field.
Mhm.
So thank you.
No
And
problem. I enjoyed doing it. I hope it helps someone.
I'm sure it will. Thank you so much.
Thank you. Bye.